Myxoma of the left atrium can also mimic radiographically mitral stenosis. This is a frontal view of the chest of a patient with myxoma of the left atrium. Note that there are prominent vessels in the central part of the lung and evidence of blood flow redistribution to the upper lobe. The lateral view of the chest shows focal slight displacement of the esophagus by the enlarged left atrium, evidence of increased surface contact of the heart with the sternum due to right ventricular enlargement, and evidence of prominence of the upper lobe pulmonary vasculature. Findings that all suggested mitral stenosis. There were no auscultatory findings nor echographic findings of mitral stenosis. Instead, echographically, there was evidence of a mass in the left atrium close to the mitral valve, arising from the intraatrial septum in the vicinity of the foramen ovale, which are the usual locations for myxomas of the left atrium. This is the venous face of a pulmonary angiogram, which shows a filling defect slightly to the left of the midline, close to the inflow tract of the left ventricle, and this was the result of a myxoma of the left atrium. This is a diagram of the previous angiogram showing the anatomic location of the myxoma. Once again, it arises from the intraatrial septum. It usually is seen when enlarged close to the mitral valve, and that explains why patients that lean forward may have ischemic cerebrovascular disease due to acute intermittent obstruction of the flow of blood from the left atrium to the left ventricle due to the obstruction of the mitral valve. When a patient lies supine, the pulmonary and systemic blood flow are back to normal, and the patient's symptoms may disappear. This is a levoangiocardiogram lateral projection showing the large filling defect of the same patient we have previously shown. This is the diagram of the previous angio, and shows the anatomical position of the filling defect. If the filling defect was in the left auricular appendage or close to the wall of the left atrium, particularly if the left atrium is calcified, we would then suspect a thrombus or thrombi in the left atrium. When the filling defect is away from the left auricular appendage, there is no history of cardiac arrhythmia. There are no auscultatory findings suggestive of mitral stenosis. We then have to suspect that the radiographic abnormalities of the chest rentgenograms are due to a myxoma of the left atrium. MRIs are other ways of imaging myxomas of the heart. The left atrial myxoma is the usual, most common location for myxomas. And this is a specimen of a left atrial